We are looking forward to it, and we just wanted to ask our beloved Saifullah to recite a prayer, and then we would like Nabil to introduce himself.
Okay. Alhamdulillahi Rabbil Alameen, wassalatu wassalamu ala rasulil ameen. I'll read the Arabic and the English as well. By the way, just to clarify, we use this greeting a lot. This is like the standard Muslim greeting. So just to clarify, Assalamu alaikum in Arabic means may peace be upon you. And the response to that is wa alaikum assalam, and peace be upon you as well. So just to clarify that. Let's get into the prayer. The first prayer is from the chapter from the Quran called Taha, and it's from verse 25 to 28. And it's a very a prayer that's probably familiar to many folks. The Arabic is رب اشرح لي صدري ويسر لي أمري واحلل عقدة من لساني يفقه قولي. And the translation is, "O my Lord, open for me my chest, grant me self-confidence, contentment, and boldness, and make my task easy for me, and loosen the knot from my tongue so that the people can understand my speech." And the next prayer is from the chapter called Al-Isra, and verse number 80. The Arabic is, "Rabbi adkhilni mudkhala sidq wa akhrijni mukhraj sidq. وَاجْعَلْنِي مِنْ لَدُنْكَ سُلْطَانًا نَصِيرًا." The English is, "O my Lord, let my entry be good and my exit be good, and grant me from the people an authority to help me."
Ameen.
All right. Well, thank you, Brother Zeph and Fatma and everybody else. Assalamu alaikum. Just quickly introducing myself. My name is Nabil, and I've just joined like last week to sort of help coordinate and develop the program. I look forward to working with you all. This is a very exciting project. Look forward to meeting you all. Inshallah. And also just another plug for the pre-assessment survey. I think a good chunk of you have completed it, so I really appreciate it, given that it only went out last night. But for those who haven't, if you could complete it at least before the next session, that would be really great. So you have another couple of days. And if you have any problems in completing the survey, just you can feel free to email me. I'm just like Nabil at Worry Free Community. Yeah, that's it for me for now. We'll talk more soon.
Okay. So Fatima, do you want me to put the slides up?
Yeah, Dr. Johnson, we can, because you're going to be presenting, or I can present as well, whichever one you prefer.
If I put them up and then you can talk for the first few, is that all right? Does that make sense?
Sure. Absolutely, and then you'll have control of it. Yeah.
Sure. Okay, so lovely. So that's okay. Present. Cool. So can everybody see those?
Not yet.
No.
You probably have to share the screen. So if you go to the end of your Google the meeting, so it says present now.
Share, share. Oh, it's shared with. Oh, hang on. The meeting. Okay, so apologies.
That's fine.
Okay. Share it. Oh, why can't I?
It should say share entire screen.
Share entire screen. Let's have a look. Share application. It should do that. Okay. So and then I think it might be, yes. I think I got it. Here we go.
Yeah.
Yes.
Yeah, sorry. There we go.
No worries.
All right, so I'm presenting. So now we need to...
and then I guess there is a button called present. That's
present.
it.
Present. Okay, yeah, there we go.
Yeah.
Perfect. Okay, so here we are.
Very nice.
First slide. Yeah, excellent. Okay. So yes, so welcome everybody to the first session. I'll just this is our sort of template for which is thanks so much to Fatima for putting these together. And as you can see, we're funded by the Patient-Centered Outcomes Research Institute, and it's a community health research collaboration. So between the Initiative on Islam and Medicine, the Worry-Free Community, and Pastors for PCOR. So I will, perhaps if I explain who I am, I can sort of say, yes, so I'm going to be the main presenter today for the Community Health Orientation to Research Engagement Science. So just to give you a little background, for the last 10 years, I've been a research assistant professor at Northwestern, and recently I have transitioned to become an independent freelance researcher. So I'm still doing work for Northwestern on a consultancy basis, which is why I can still use the logo. But I'm also working with another engagement group called Pastors for PCOR, which is also focused on community health outreach, like you are. And we have been working together for the last sort of I think it's almost 8 years. And I was working with a group of Baptist churches, and we were putting together a program on doing research. So we were learning to do research with researchers about health conditions and health priorities, which they had identified as being important in their communities. These are on the south side, predominantly. The lead church is based in Beverly, in Chicago, but there are 12 other churches who are part of the network, and they are sort of they are around Chicago, but they're all full gospel Baptist churches. So that's who I am. And if you would like to learn anything more about me, you can see more about my projects on my LinkedIn. I think that's probably the best place to see more about me. And please do, I'd love to join you on LinkedIn. I'd love to sort of, join you and talk to you on LinkedIn. But you can also, I think my email is also on the Worry-Free Community website as part of our partnership. So just to give you a little background, my PhD is actually in English literature. I did that a long time ago back in the UK. And my master's is in gerontology. So I translated over to, I transitioned to become a full-blown social scientist, and bringing in the humanities. And I'm mostly a qualitative researcher. So I do the science of research engagement, which is what I want to talk to you a little bit about today. And I've worked on PCOR projects for the last 10 years, mostly about research engagement science. So that's who I am. And please feel free to ask any questions in the chat as we go through. Anything you don't understand as well, please feel free to make a note and then share that with us in the chat as well. There are lots of words. One of the things that one of the hardest things about this work is learning to speak the same language, and so we're going to try and help you to do that and give you the resources to be able to speak the same language. But research engagement science, PCOR style, has a very specific language that we do need to learn and understand when, for example, people talk about stakeholders or patients. There are specific things in mind. Okay, so these are, yes, we've, I got this, we're zooming. There we are. So today we start with a welcome and a prayer. Thank you. Nabil has just introduced himself, and I think Fatima will go over the core competencies, which is related to the assessment the pre-assessment that you have just done. If you could do that assessment before this session today, maybe while I'm talking at the beginning. The thing is, really, it's asking you to assess your abilities before you start. And then we will see whether or not you feel that you've gained the ability you've improved, you feel yourself that you've improved in ability, in the same set of abilities at the end of the training. And you'll see which skills we're thinking about dealing with today. I'll let Fatima talk through that. But yes, today is an introduction to research and science. Now, for me to get to know you all a bit better, I would like to start by asking a question of you all, which is a question I've asked with other partners, and I think it does provoke some quite interesting responses. So I just want you to think about, to help you get into the mood of thinking about research. So can I ask you to think about this, your answer to this question? So if research were a colour, what colour would it be? And to give you an example, I've given you an example from a PCOR ambassador who I asked that question of. And she said, if I were to relate research to a colour, it would be blue, because the sky is the limit for how creative we can be to ensure everyone has a better quality of life. Being an ambassador provides the canvas for that creativity. I love being an artistic ambassador for PCOR. So if I could ask each one of you to just sort of share that, and maybe we can hear from 5 of you initially, and sorry, because I don't want to take all our time on this, but I do. If you could say your name, and then what colour would research be if I were to ask you that question.
I'll start. I think if I had to define research as a color, it would be green, because there's so much opportunity for growth, and green is typically associated with, plants and just like everything that, like crops, that kind of thing. So it would be green for me.
Great, thank you. I share that too. I like green. So, yeah, same reason. Did anyone else like to share?
I can share. I was thinking, can you hear me?
Yes, thank you.
I was thinking the color purple, because it's a royal color, and I feel like research is kind of like one of those higher ideals to bring everyone to a higher level. So it feels like me to like a purple color.
Yes,
so we can achieve excellence or go for excellence, that kind of concept.
Yes, no, I love that. In fact, that's very funny, because one of my colleagues refers to Northwestern as the Purple Palace, and very much along the lines that you're saying. So it's this idea, and I sort of feel I ought to say that research is purple because of Northwestern, but I don't. Yes, it's not necessarily the colour. So thank you for that. That's right. So we've got blue, we've got green, and we've got purple. Is there another colour people would like to share?
I'm not the most creative person, but I can give it a shot. Perhaps a color that could be associated with research could be yellow, because when I think about yellow, I think about like the sun and how the rays of the sun touch every aspect of the day-to-day. So like, I feel like that's what research is as well. Like, research is not just limited to like labs or certain agencies or organizations. I feel like research, can affect every aspect and every individual in the community, in society. So
yeah, no, that's lovely. I think so too. And it's just like sunshine, isn't it, in that sense? Yes, I love that. That's very nice. So we've got blue, green, purple, yellow, and so one more colour. So we'll go for 5.
Hi, I can share my color. Honestly, I was thinking about it right now. I would choose like black, not to be pessimistic or anything, but like, because like research tackles the unknown and tries to basically discover like results and like basically like illuminate. So it's kind of black, but it emanates light in the end. kind of like something like that.
Yeah, no, I like that. That's very nice. That's very good. Yeah. Yes, and I think that's very nice. So it's almost like it's darkness. So and then we get the light. Yes, that's right. We don't know what we can find out. So those are lovely. And what's really nice for me is I can hear that you've got there's a real sort of engagement with the idea of research. So that's really nice. So thank you. So those are five nice examples. So okay, so just moving through. So yes, I think I just said at the beginning, Nabil introduced the pre-assessment survey, and I've sort of reiterated why we want to do that, because there are specific, and as Fatima is listed here, there are specific skills, competencies and qualities which are associated with your work as community health work. And what we are exploring with you is that we have a hypothesis that engaging with research will help you to your abilities in these skills, competencies and qualities which are associated with community health work. So we wanted to ask you to self-assess these abilities before we embarked on the whole training program, because we will then sort of ask you to do this again at the end to see whether there's been a change in your confidence levels, and to see whether you feel that there are specific examples from the program that you can sort of use to illustrate your ability in these areas. So if I can show you so for example, these are the skills. So you've got, these are the skills. So you've got communication skills, you've got interpersonal skills, you've got coordination skills, you've got capacity building skills, you've got advocacy skills, and you've got education and facilitation skills, assessment skills, engagement skills, professional skills, public health skills. Is that all of them? I think it is. Mm-hmm. Yeah. And so what we're thinking today, I've highlighted in bold the skills that we think you might be able to, that today might help you with your ability. You may already feel that you're very good. You may also already feel that you have a good ability to find and share requested information, or to respond to questions about a variety of topics, and that's fine. So, and it's fine if you feel that now, and you feel that at the end of it as well. In fact, I'm hoping that you do. And sort of the public health skills, knowledge about pertinent health and issues, you'll begin to see how PCOR can help with those, and knowledge about determinants of health as well. So as we're going through, we'll try and highlight these skills that we are hoping to help you learn through this program. Do you want to add anything else, Fatima?
I just want to go over the competency, the 10 or 8 competencies that are there.
That one, yeah. Mm-hmm.
Yeah, so I just want to highlight here to everyone that competency is actually is a very specific thing that we build in ourselves. It's actually the junction of 3 roads meeting together. Number 1 is knowledge. It's a road of knowledge. The skills aspect of it, or the roads to a skill, and then the confidence. So when you have these 3 things embedded, that's what creates a competency. So we talk about, nurses and people in healthcare, especially when they are in patient care, where there is a special skills that are involved. They're actually very often tested the competency. The physicians are also tested their competencies. Pretty much anything that you have to show, you are tested a competency. Likewise, in community health, whether you are a researcher, you are an advocate, you are an outreach person, you are a coordinator, whatever you are in community health, your skills have to be competent, which means you have to have knowledge. You got to develop a skill set, and then you have to have the confidence. Now, the funny part about confidence is that if you do the other 2, knowledge and skill, the confidence comes with it. So as long as you it's the skill that when you practice a knowledge, that you develop a skill set. So we can help you with both of these, but we cannot help you with confidence. So that it's the confidence that when you commit your time and you commit yourself to this material and to the discipline of community health, you're going to build that confidence. So that's what we are really. I'm hoping genuinely and sincerely that by the end of this session. The training session, of course, but by the end of the conference next June, we have built enough confidence in you guys that each one of you would walk into the community health environment, no matter what kind of it is, case management, patient care, coordination, or research. You are as confident about yourself and about your skills and about your knowledge to do community health. So having said that, there are 8 competencies. No matter which path your career takes, you want to build on these 8 competencies. If you want to do any work in community health, it is community engagement and advocacy, system navigation, participatory research, public health, coordination of services, education, social emotional support, and community and cultural liaison. So we're going to do our best to provide you with the knowledge and develop and help you develop that skill. And your commitment will bring in that confidence. So good luck to the journey of competency building in community health.
Yeah, thank you. Thank you so much. Yeah, and I'm sorry, I'm not quite sure what you saw during that because I was trying to see some notes, but it's okay. So I hope that's okay. So fantastic. Okay, so we'll go to the next slide. Okay, and so those were the skills. So yeah, anyone has any questions at this point? Please do drop them in the chat box. And Fatima, could I ask you to keep an eye on the chat box?
Yes, I'm keeping an eye on the chat. Absolutely. Thank you.
So much.
I'm muting myself.
Yeah, lovely. All right. So great. Okay. And then the other thing I think is that the other thing that's very important, and I know you will all know this as community health workers, so the personal qualities and the traits that go along with your work. The qualities of a community health worker, which are cited in the American Public Health Association, that's what APFA stands for, and adopted by the Illinois Department of Public Health, are things like being a team player, being empathetic and compassionate, relatable, being able to share life experiences, a good communicator, an active listener. So, and all of these are incredibly important qualities, and they are all things, funnily enough, that researchers need to exhibit as well. So we feel that you are well placed to, given that you're probably using all of these qualities, you have these qualities, and you to be community health workers, you're well placed to sort of translate those into the behaviours which also go along with being a researcher, where when you're talking to somebody about a study, you're having to you listen, you relate your shared experience, and we hope that these qualities will be developed by the programme as well. Okay, so the goals for today, very much to get to know PCOR research and researchers, become familiar with the language of research engagement, particularly frequently used terms in PCOR research engagement science. We want to introduce PCOR research and researchers by giving you some examples of engagement in Chicago. And then we want to make sure that you know how to access examples of engagement on the PCOR website, so that after today, you can think about what you've heard today and you can go and explore a little bit more, and also maybe find out how is PCOR engaging community health workers for some other projects and how are community health workers being engaged. So getting to know the PCOR research and the researchers, that's the first step. So speaking the same language, and as I said, this is difficult. I mean, community health workers, you all have your own language and your own sort of abbreviations. And I'm sure medics do, and I'm sure as you've experienced, researchers do. And there's so many different terms, and they're all used. People mean many different things from them. So it's very important to have a shared understanding. And the place to go for a shared understanding of PCOR is the glossary at the end. So you can see the link at the end. So I encourage you to sort of go to that glossary and just sort of interrogate the glossary for key terms. Now, you'll notice in there that there are some terms that aren't defined. But there are two here that are. So the patient engagement in the PCOR glossary means the involvement of patients and other stakeholders throughout the planning, conduct, and dissemination of research. That should say at the end. Stakeholder partners, it means professional rather than personal experience. So the patients bring personal experience to the table, and they may often be advocates and have experience of advocating for particular conditions or interventions. But the stakeholder partners could include clinicians, healthcare, purchasers, payers, industry, hospitals and other systems, policymakers, training institutions, and also other researchers. And so those are two key words. Now, the word that isn't in the glossary is community. And so that is, and that sort of comes under other stakeholders. And that, from my work with the pastors in the South Side, that's for them. It's a faith-based community. That's how they define it, and then they talk a little bit more about what that means. So there may be room for us as a group and you to think about what do you want to define yourself? What type of community do you want to define yourself as? What sort of stakeholder? Or do you want to define yourself as a stakeholder partner? So these are all interesting discussions and questions to have. But I just wanted to give you health research and health science. I work with another project, and one of the most difficult things is to not only learn to speak the same language to each other, it's also then explaining to community members or mosque attendees what's going on, and that is the hardest thing. So one of my colleagues equate in another project, they equate health research with science, and so when they're talking to community members, they will talk about science. And when I present my slides to you, these are all what I'm trying to do as well is help you to learn and understand, but I'm also trying to give you some examples that you might be able to use with the wider community, things that are accessible. And I use lots of pictures. So I hope that that helps you as well, because people learn in lots of different ways, as Fatima was saying last time we met, and many community members like visuals. So like everything else, science has a story, and as a social scientist, legacy, stories, history is very, very important to me, and because that helps me to understand the context that things have come from. And so you'll be surprised to probably hear that in 1859, that was when Northwestern was founded, for example, and it was actually it was founded to address public health issues. It wasn't founded to be a medical school, and so it was. So I forgive you here. This is the public health timeline for Northwestern, and you can see in 1859 it was established as Linda University Medical Department, charitable care, educational rigor, public hygiene. And the reason why there was this focus on public hygiene was because between 1850 to 1920, there was real problems in Chicago with sanitation. And so there was a big focus on sewers, building the sort of sewage sort of pathways, water, food and dairy. There was they realized that they needed to start reporting contagious diseases, and this is when, during this period, was the time when the reversal of the river was actually considered to be a medical intervention. So I think you might be quite surprised, but Northwestern began life really as a public health intervention. And then later in 1930s, of course, there have been other sort of, there have been epidemics which science has needed to respond to. And obviously that was smallpox in the 30s, and then 2019, obviously we've got COVID. So I think research has evolved in so many ways over the years, but we are, with the COVID, it's almost like we're back to the focus on research and health research as being a sort of intervention to help public health. And so what's happened since 1850 in the evolution of science? Obviously, the funding comes from the federal government for NIH, and I know Fatima is going to talk a little bit more about all the funding sources and how for research and where they go and who they go to. But one of the things that in 2000, I think it was about 2000, Joe Selby and a group of doctors felt that medicine and medical research really had got too far away from the patient. There wasn't there was a disconnect between the research and who it was for. And in 2000 the Affordable Care Act came into place, and a group of doctors advocated for more engagement of patients in health research, and more partnership, more funds for partnering with patients, more patient-centered outcome research, and efforts to communicate findings of research in a more accessible way. And that's why we have had the funding over the last 10 years to develop research science. So the idea was that there will be an accelerating trend for scientific research engagements, which we have seen through, for example, the Centre for Medicare and Medicare Services actually has a slogan, "Patients, not paperwork." The National Institute for Health has, you may have heard of their All of Us initiative, and I would encourage you to have a look at their website, because there's lots of really good materials on the All of Us about explaining research and what it's for and the benefits of it. They have developed, the NIH has developed a lot as part of that program. Now, the idea is to deliver workable science and results that matter. So we'll keep coming back to this, I think, is that it's this is the PCOR sort of vision, as it were. It's not what do I, the scientist, the researcher, the doctor, think matters. It's more what matters to each of us. So that includes everybody, the community stakeholders, researchers, our audiences, and the patients. And as part of this has been an accelerating trend for including more lived experience, and that often there's often advocate storytelling, and also patients, which is patient stories. And I'll provide you with a link to the patient stories so you can check out some of those and see some examples. And the idea is to make science more human, and to reach many audiences. So instead of just having the outputs for researchers writing to research for other researchers in medical articles, again, it's about what matters to each of us, and it's finding ways to communicate the results. Because what Joe Selby realised, and a lot of colleagues as well, is that research were not reaching the right people, or they were not reaching everybody. And communicating findings to study participants and their communities is a practice that often gets overlooked or receives low prioritisation by research investigators. Partly because publications are linked to promotions, and so that there had been a sort of, I mean, if I published, for example, in JAMA, that's a very prestigious publication, and that would help my career. So there's a whole there needs to be a systemic shift in some ways to ensure that the results are not just being shared with other researchers or doctors or the medical community. They're being shared with the study participants and the communities. Okay, so any questions at this point? I'll just take a little pause. And please sort of share any words that you feel Dr. Johnson said that, and I don't know what that means, or I'd like to know a little bit more about that. And please feel happy to share those at the end as well. Okay, so this is, so Fatima and I was thinking about, okay, so how do we introduce PCOR research and PCOR researchers to you? So as Fatima said last time, our funder is PCOR, and the focus of PCOR is producing and promoting high integrity, evidence-based information that comes from research guided by patients, caregivers, and the broader healthcare community. And so the Patient-Centered Outcomes Research Institute, which was the research institute funded at the same time as the Affordable Care Act, so it was funded to provide the research needed to keep the Affordable Care Act and alive and sort of evidence-based. The idea is it helps people make informed care decisions and improves healthcare delivery and outcomes. And Joe Selby, who was he's stepped down now, but he was the original director of PCOR, came up with this quote, this line, this summary, which I think is great. PCOR must do research differently in terms of the questions we ask, the outcomes we study, and of what we do with the results. So all the slides I showed you before, this is the journey we've got to. In 2000, this is where we were as researchers, as doctors, as medical sort of specialists. We realized that we needed to do research differently, and PCOR provided the funding to do that. And this is a slide that Fatima kindly shared, which shows you the research cycles into funding priorities. So it's paths from priorities to research, which patients have identified often, and then you go to a research agenda where patients and researchers work together to decide how to address. They identify the tools and the methods needed to address the priorities, and then there's the funding for research, and then there's the research results. So it's this cycle that but what makes PCOR unique is it's saying that patients and communities should be involved at all stages. Okay, so So one thing I really do want to stress to you, and this is to take away, is that there are two key characteristics of PCOR research. There are two types. There is what PCOR calls programs, and then there's what PCOR calls research. Now, the programs they fund the patient. They only fund patient stakeholder. They fund the research, engagement, science. The research is very. Researchers have to do what's called comparative effectiveness research. So they have to compare different strategies for improving health, well-being, or care. There's the mandate. The mandate for PCOR says that PCOR researchers do comparative effectiveness research. But the other aspect of the clinical research is that it has to include patient stakeholder engagement plan. So the comparative effectiveness has to be done by bringing the state with a plan which says how stakeholders will be brought to the table to share knowledge and perspectives, because there's the hypothesis that this will improve the relevance and the use of results. So here's an example of the engagement programs and the research across the US. And as you can see, this gives you an idea of how many projects have been funded in different parts. And I'm going to try and use a pointer. I think we've got, this is Michigan, this is Chicago. So as you can see, there's a lot of, I think that's Chicago. There's a lot in Chicago, a lot along the sort of East Coast. Yes, a lot of them are sort of urban conurbations. But there are some rural ones as well. So okay, so those are programs. There's a map of programs and the research that's going on. And here are some examples of faith-based communities across the US. So there's Pastors for PCOR in Chicago, and then there's an Arkansas Faith Academic Initiatives for Transforming Health Network that's Arkansas, and then there's Tennessee Sickle Cell Disease Network project at Vanderbilt as well. So and you've got the links below. I would encourage you to have a look at these other projects if the idea of a faith-based community is what's interesting to you. There are also a number of PCOR programs in Illinois, and I haven't put numbers in because these are going up all the time, but there is obviously us and the project that preceded us, the Engaging Muslim Americans for Research on Community Health, the eMarch project. There's the Pastors for PCOR, and these are both engagement projects. And then there are projects, bigger projects like the patient-directed outcomes for skin cancer up in Arlington Heights. But there are many more. Okay, so what does a researcher look like? What is a PCOR researcher? So here, this is Shyam Prabhakaran from the University of Chicago. And so he's an example of a PCOR researcher here in the University of Chicago. And he's what's called the principal investigator for CERIAS, which is Community Engagement for Early Recognition and Immediate Action in Stroke. And we did in another project, we did a little interview with him. And it was a project where he had finished his project, and we were asking him how he might use community media to disseminate the results of the project. So we asked him how to describe himself and his work, and he said he wanted to describe himself as a health services researcher. We asked him what he hoped to gain from partnering with us to disseminate the news of his research through community media. And he said he wanted to gain more experience and collaboration of working with a community group and lend his experience as a researcher to others. It's a completed project, and there's a story about that on the website, which I would encourage you to have a look at. So that you can see how that project, the results of that project, how they're presented, and also what they did. Now, the thing about the PCOR results is that all of the projects that take place are reviewed by community stakeholders, patient stakeholders, and they all have to pass a sort of accessibility test. So they should be understandable. They should be, I think it's grade 10. When I tested it out, and they seem to be at grade 10, and so that's a good level to aim for in terms of general accessibility. And then what they do on their website as well is they give you audio results, they give you written results, and then they sometimes give you a fact sheet. So yes, okay. So just to give you an idea of a question, so this was Dr. Prabhakaran's question: does a community engagement program help increase early hospital arrival and ambulance use for patients who experience stroke? That was his research question. And he asked it because as an ER doctor, he had realized that there are certain groups were not phoning 911. So the comparative effectiveness question, which the research put together, was the team compared stroke data from the hospital on the south side of Chicago, where the local communities had training on how to use 911, with 2 hospitals serving communities that did not have the program. And they trained 242 people from local churches, schools, and businesses to be community educators. And as a result, they developed a unique outreach program. So here you are. Here's the source of the PCOR question. The source of the PCOR question was data actually from the Chicago Department of Public Health. Sorry, this is a little fuzzy, but this shows the prevalence of stroke. And so from that, Dr. Prabhakaran said, well, okay, so does a community education program help increase early hospital arrival and ambulance use for patients who experience stroke? And he did a community education program, but in the process, he found out the reasons why people weren't using 911 and they weren't accessing the ambulance, and he found out things like people they didn't have the money to pay for the ambulance. He found out that they didn't want to be taken to the hospitals that the ambulance was assigned to take them to. So they by talking to the community, they found out why that people weren't using the ambulances, and also they managed to develop a program to help increase the use and address some of those concerns and some of those barriers. So yes, so he's, why engage? Why did the community want to engage? Well, as stroke is a time-critical disease, really matters when you phone 911. It really matters that those early stages and what you do in those early stages. The stroke disproportionately affects minorities. There's a delay, is a major driver of poor outcomes. And there were lots of race and ethnic disparities in stroke awareness, recognition, and appropriate action. Now, the other thing I just wanted to sort of throw into the mix here is, as you'll see this is a map, basically, which is based, each little dot on here is a person. Whereas this is a map, as you can see, which is by, I think it's community area. So it matters when we talk about the big data, which we will be doing in the next session, in session 3, when we get to talking about the big data, the sources of big data, which help us to create the questions, it does always matter how you divide that data up and how you group the data. So that's, I think, Fatima, do you want to let's have a little pause. Any questions at this point? And then I think Fatima is going to sort of talk you through how you can actually go to the website and sign up to be a PCOR ambassador, which is another way of finding much more out about the program and also joining and getting together with other people. You all right? Fatima, do you want to keep going with that?
Any questions, guys? Thoughts, maybe?
Yeah.
Maybe thoughts that you guys want to share?
Yeah. Does it all make sense? That's the key. Anything that doesn't make sense, do ask. I know there's a lot to take in, so obviously, it's sort of at this point, you're probably sort of absorbing and thinking about it. But yeah, so please do note down any questions as we're going along and share those as well. So okay, so
I'll tell you what. I'll tell you guys one thing. So it took me. I've been doing community health for the past 10 years or more. And prior to community health, I was in hospital management, information systems, healthcare IT, basically. So I've dealt with data all along. And prior to that, I was actually why people did not want to call ambulance. Okay, I'll get to that, Jimmy, in just a second. So prior to that, I was in basic sciences health research. So I've been through all sectors of healthcare, and I'll tell you something. I have known PCOR for about 18 months, and in about 14th or 13th month, PCOR started to make sense to me. Because I didn't know when they said research done differently. I have been in the lab. I've been in the forefront of research, literally basic sciences research. You can't get closer to science than that. But having done that, I didn't know what did it mean to do when they talk about research done differently. And there is a fundamental difference in how we think about the research question. And just the research, in order to formulate that research question as to exactly what factor you want to look at, it takes all of us. It takes all of us. And that's what PCOR means, that doing research differently. So when I understood that, that's when I said, wow, So pretty much the 99% of the people are actually in dark right now, as you said, black, because they don't know the other side of research done differently. So then I said, wow, we really need an entire push, an entire culture of community health research. And therefore, this project was really born out of that passion to bring to be a part of doing research differently. So then I further delve into PCOR principles and how they are doing things differently, how they are connecting every healthcare practitioner and a physician and a patient and a stakeholder in as a community together and with a focus of what they want to go for. So even though you are going to be a part of big network called PCOR, you would still have your own focus. You can still engage in the questions that matters to you, and that's the beauty of the entire network. And I said, wow, you can still keep your identity. You still would do everything that you want to do, and yet in a much more powerful way that people are engaged with you, people are involved, you have a team, you're not a solo player. Nobody becomes remains a solo player. Everybody works with a network of like-minded people, whether you are a physician, you are a DO, you are a social scientist, you are anybody. That's what it does. And that's really so we'll take some of these comments here. What happened after they found out that the reasons as to why people did not want to call the ambulance? Jimmy had asked. So Jimmy, that's a study question, and I would highly recommend that to go onto that website. These slides will be available to you. Go onto the PCOR website. You can read about the study. You can look into the details, and actually perhaps use this information to the best of your advantage, the best of your community's advantage. That's the entire job of PCOR. Every single study that PCOR funds, all the results and the findings are on the website. And I have actually found a lot of good information on there, learning from other studies, and borrowing from the other studies into the work that I'm currently doing. So definitely, it's a good question, and I would direct you back to the actual study, and there are study findings. You can read about it in the details. Personally, I'm not familiar with that, what exactly happened, and I'm curious about that too. So that's what I'm going to do.
So can I
Sure, please.
Yeah. So basically, yes, what they did, they found that's when they realized that they needed an education program. So having found out the ways that, having done the focus groups and finding out why people weren't using the services, they then did an education program. And what they then did is they realized that they needed community champions. So they trained members of the community, and this was with Black and Hispanic community groups. They train, and one of the Pastors for PCOR, the Research Ministry ambassadors, took part in the training, and they provided those people with very, very good materials. So it was explaining basically, and fridge magnets and things like that. So it was, when to call 911, how to recognize a stroke and an event. Now, they have actually since got further funding recently, and I'll try and share that with you as well, because they've realized that was the bit. They could do the intervention in the sense that they could do the training and they could do the champions, but it was they didn't really put in place the sustainability for that. So, because obviously one of the problems with research is it's often not longer than 3 years. And so there's always that issue that you engage the community, you find things out, but they didn't go back to the communities that they got the focus groups from to communicate what they were doing. They just trained the people who was doing the intervention. So they've got some more funding to do more on social media and keep the intervention and the need to call on 911 alive.
Okay.
That's a great question. So I think there's a, sorry, I can't see the whole thing. So I think there's another question. Does PCOR recommend on picking up the comparative methodology, or are there standard methodologies recommended that had worked in the past? So yeah, PCOR, any researcher who puts in a proposal for one of the calls, the PCOR, what they call them is it's gone out of my mind. But so a research sort of call has to do comparative effectiveness research. So they have to do a comparison of two things. There are standard methodologies recommended that have worked in the past, and that's a great question, because the majority of methodologies used are surveys. You won't be surprised to hear that. But they're also, obviously, as I just said, sometimes it's comparing educational. It's comparing what happens when you give one group education and you compare that with another group who are not getting that education. So there are standard methodologies, and we will go into that more. First of all, we will in the session where we're talking about big data, we will go over where you can get the sources of the data, but we will also then look at how the tools that you can use to mine that data, but also the methodologies that you can use to sort of work with communities. Now, as a qualitative researcher, I'm interested in things like interviews, focus groups, sort of photo voices, sort of more observational things, but and education and training, because I think education and training is a huge opportunity for intervention, positive intervention there. So yes, and there's a great summary of the methods on the website. Yeah, with examples. Yeah.
So I can go over the ambassador piece.
Sounds good.
In the meantime, if you guys have any questions, please keep listing.
Oh, sorry. So let me go. Sorry. Yeah. Let me go to the. Here we go. So yes. So this
there is actually so PCOR's website is very extremely user friendly, and they engage. It's a platform for engaging pretty much the entire breadth of researchers and stakeholders that come together on this platform. How many people, by the way? You guys did answer. Some of you did attend some of the sessions, but I would recommend going back to the PCOR's annual conference that just happened and make sure that there were community health sessions and community engagement sessions that you attend. You can review them online. They are available on demand. So one of the ways to get actively involved in PCOR research and all of these projects and get yourself known and interact with the people who are doing very similar work is to become a PCOR ambassador. So PCOR ambassadors are actually the people who sign up. It's a very simple process. It's a no-brainer at this point, actually. This discipline, I want to say this patient-centered discipline is really developing at this point, because as scientists have realized in the past two decades, that's how things have happened with the sciences. Every decade you have an evolution of thought. And in the past 2 decades, we have realized that involving patients and stakeholders is going in a community will be bringing out lots of good and would healthcare outcomes to the entire population. So the patient-centered research or the participatory research is really in its infancy stages right now. So you would find lots and lots of opportunities. So you guys are literally grandfathering this era. If you were to think in a span of time over a period of 100 years, you're literally grandfathering this era of participatory research. And being a PCOR ambassador is very easy right now. And you can be a part of it. You can make a dent in your own profession and with the healthcare research. So I would highly recommend all of you to join, to become a PCOR ambassador, and sign up as a PCOR ambassador. There is actually a small training program that you can do. And I said, Jimmy said join. So that's perfect, Jimmy. That's great. You are ahead. Beautiful. And in fact, you can take the small online training if you'd like to do that, become part, and you can interact and converse with other PCOR ambassador too. There is an ambassador platform where they can discuss things, post things. You become a part of their network. And your stories are actually also highlighted. And Dr. Johnson, if you want to move ahead, so these are some of the PCOR ambassadors that are out there. Dr. Johnson would recognize Regina. She's from Pastors PCOR. This is a very wonderful testimony of how they have transformed their community. And there are lots and lots of tools available to you as a PCOR ambassador. People listen to you, you get listened to, and you listen to them. In fact, what you want to know about. So it's a beautiful place to be at. And so they actually, your profile goes there. You become a little about yourself also goes in. Your profile picture goes in. So you would find my picture on there too, because I became a PCOR ambassador some time ago. Loved the program. And so, you get requests from other people to ask them, how do you do some of these things, or how do you get engaged? And you get to, so you become one of those leaders at the forefront of community health research that are actually engaged in patient-centered research. So it's a beautiful time. And the next one, so basically, if you go to the PCORI.org and go to the engagement, so you can see that engage with us and PCOR ambassador program, and you sign up. That's it. That's as easy as that. So here's the PCOR engagement page and getting involved, and you sign up there. And when you sign up, these are some of these icons on the right side of the picture. They actually they actually will tell you the ways you can get involved. And so building and promoting a PCOR community is one of the best ways that I've found getting involved. You can also be a merit reviewer. You can be a part of their stakeholder community. You can be a part of recruiting and retaining PCOR supporters. Engage in PCOR in many different ways. You share the translating research findings. We're going to go touch at the next week, on Monday, actually, we will touch over the translational sciences as well. But I'm really looking forward to this journey with building a PCOR community within our community, and bringing this culture of patient-centeredness and bringing this culture of healthcare research with similar mindset and similar actions that we can count on each other for. So I guess this would be my 2 cents to become a PCOR ambassador. Any questions, guys?
Yeah. So perhaps could we ask? Is it Jimmy who's already signed up? So did you find it easy? And was there? Could you just go on and sign up easily? Okay. I understand it is very easy. It is very easy.
I don't know what happened to Jimmy.
Yeah. Yeah, but yes, I'd share. I don't think it's difficult, but I think yes, if anyone does have problems, use us as a group to ask questions. Okay, so yes, so you might at this point be thinking, well, okay, but what does patient-centered research look like in the field? So we've given you an example of what it looks like from sort of researcher point of view. You know, Dr. Prakarakan as the principal investigator. So research teams have a principal investigator, a co-investigator, and then they often have project managers, and the community partner, ideally, in my view, should be a co-PI or at least a co-investigator. And often PCOR asks why not, if that is not the case. So, but there's that terminology just to get your head around as well, which is sort of, you know, the nomination, the names for the different members of a research team. So if you go to the PCOR Stories site, you will be able to hear from researchers about what it's like to partner with patients and other stakeholders. Remember the other stakeholders that we looked at in the key terms. So it could be health systems providers, could be faith-based communities, could be other researchers. You can also hear from the patients themselves about being part of a research team. And many patients are patient advocates who have been passionate about their particular finding better interventions for their particular health conditions. Some of them are rare conditions, and many patient advocates have set up their own organizations. And I'll give an example actually in the next slide of a lady here in Chicago who has done that. But they're experienced advocates, and so that is important. The thing is, I think as well, is that as community health worker professionals, you have one hat, but you too may also have a hat as an advocate, as a patient. You may also be a patient or a caregiver yourself of somebody who, so many of us, for example, look after older adults with dementia. So in that case, you may be a caregiver, and or you may have had a diagnosis for cancer and been through that process, so that you are able to comment from lived experience on that too. And so those, don't forget that you have, many of us have multiple hats. We can be researchers, patients, and health system providers. Learn how the work that PCOR supports research done differently, and the way that it can make a difference for patients, caregivers, clinicians, researchers, and others. And so you'll see a lot of different stories on the website. You'll see stories of a lot of educational training, for example, for home care aides to have better communications with the people that they're looking after. There's sometimes research is focused on changing policy. So another one, for example, is a diabetes study where they wanted to change they wanted to change the way in which a diabetes diagnosis was made, and so the patients got involved to advocate for that change. Trying to think of other examples that come across. So many of them are to reduce health disparities. So it's about sometimes they're about better communication between different aspects of health systems. And still others are sort of comparing ways to help people to access services as well. But you can find a lot of different examples on that website. So here are some different stories. So Bev Rogers is a PCOR ambassador. She was also on the PCOR advisory board for patient engagement. So she got involved, and Bev is a caregiver. She cared for her husband over many years, who was diagnosed with dementia. and she cared for him as he sort of aged with that. Unfortunately, he's passed now, but that's how she got involved. It was through basically battling the healthcare system with her husband Amos, and she learned a lot about the system through doing that. But she also sort of and came to the point where she wanted to sort of get her voice heard and represented at the table, and so that's one reason she became a PCOR ambassador. And you can hear a little bit more about Bev and her role and why that was important, how she became an ambassador, and what the experience she brought to the table if you go to that link. If you want to learn a little bit more about Passes for PCOR and also the research engagement that they have been doing, this is Dr. Davis, and she's the lead for the Passes for PCOR engaging faith-based communities in Beverly, as I mentioned, in Chicago. Now, she talks in this video, she's talking about the importance of building trust. Now, we'll come back to that a little bit more, because some of the barriers you may, in your head, you may thinking, well, this is all very well, but I can understand this, but this is going to be difficult to explain to my community members. And so we spent a lot of time talking about what some of the barriers would be for the people that we knew to access the research or even engage in a sort of take part in a study. We talked a lot about those barriers, and Dr. Davis sort of found that a faith-based community was a space where trust, people could share ideas, they could share experiences, because many people have had bad experiences of the health system, or they feel that the research does not apply to them. And so there are those safe spaces where you can have those conversations to build the trust. And so the building the trust is very important. And then Candice is the patient advocate I was just mentioning earlier. Now, she is a colorectal cancer survivor, and she's unusual because she is an example of a patient who is outstripping the research, because research can take a long time to come to fruition. But she's basically shouldn't have lived as long as she has done with the condition. And so there's no research really on people who go beyond a certain age for colorectal cancer. So she set up Blue Hat Foundation, which is an advocacy group for people with colorectal cancer, for African Americans with colorectal cancer. And as an advocate, she has really got to know the healthcare system. And she's part of the University of Illinois at Chicago's Patient Brigade, which is a group of advocates and survivors who basically inform the Cancer Center at UIC about what they want to, the research they want to see done. And because hers is her area of expertise is in a research area which is not well documented, that is crucially important in terms of next steps. So those are examples, those are the types of stories that you can find. And they're fantastic. All of the stories are fantastic. What you will see when you go to the website is you will see that basically PCOR funds projects in certain areas. So by which they have systems. They fund projects for interventions and comparative effectiveness in health systems. They also fund projects to address health disparities. They fund projects to deal with communication, and they fund projects to deal with dissemination, so communication and dissemination. These are all projects that they invite medical researchers to engage with community groups and stakeholders to improve the state of health provision in the States. Okay, so we'll just take a little pause there. Any questions about the stories? Anything you would like to ask? Anything about that, or the key going back to the key words? Are there any words that have come up that you think I don't know what that means, or I'd like to know a little bit more about that? So we'll just pause for that for a little bit. No, we're all good. Excellent. Okay. All right. I mean, the other thing I would really appreciate from you all is if I'm talking too fast or I'm, you would like me to, yes, please do let me know, because obviously all of this is virtual. Sort of, and it's a difficult forum, and I also know my English accents can actually be a bit confusing as well. So I've had some hilarious problems with that. So I call it what I call a lift. I've learned that Americans called elevators, and so that there's just examples like that all the time. They're just quite funny, but also annoying. And also the other thing is I'm a gerontologist, so I do the study of aging. So there's a spelling thing. So if you notice things you think, I don't think that's spelt right, that's probably my fault. So for example, aging in the UK, I would spell aging A-G-E-I-N-G, which obviously here it's A-G-I-N-G. And the same with colour as well, C-O-L-O-R and then C-O-L-O-U-R. So please, I'm sorry about that. I do apologise about that. The other thing I was almost going to present to you today, but I would welcome, whether or not I need to when we come to the sources, is how familiar are you all with reading research, with reading sort of, the type of literature that gets published in JAMA or Medline or, those sorts of articles? How familiar are they? Would it help to have some guidance on how to read those? Because I have got some sources that I could share with you next week. Next week on that. So please do let me know. Okay. Right. Okay. Right. So yes, that's a good question as well. Briefly, what's the difference between PCOR and community-based participatory research? Yes. Now, Fatima and I had we had a good chat about that actually earlier in the week, didn't we, when we were putting the slides together? And do you want to do a brief one now, Fatima, or do you want me to wait?
We can do a brief one. Yes, please do. Please go ahead. Yeah.
Okay. So basically, as we've been talking through PCOR, you've probably really picked up the emphasis on patients and individuals with patients, and a less of an emphasis on community. So in my mind, community-based participatory research always starts from the community. The community has the idea, has the resource, has the engagement, and then almost like the ideal community-based participatory research exercise would be the community asks the researcher to come and help them investigate an issue. But it would be something which benefited the community. And I think underpinning the idea of community-based participatory research is it will improve health equities and reduce health disparities. PCOR is much more focused on the patient and the patient-centered outcomes. It is limited as well by the community-based participatory research can be any method. But PCOR says it must be comparative effectiveness research. So it must compare two interventions. So there's that limitation. And I think PCOR research may lead to health reductions in health disparities. It may lead to an improvement in health equity, but not every project has that goal. Does that make sense? We'll say a little bit more about that. We are going to revisit that.
Yeah, we will definitely revisit the two concepts, because in your public health domain, you must have read a lot about community-based participatory research that definitely preceded the patient-centeredness. And in fact, patient-centeredness have grown out. It sounds like to me, I'm a novice when it comes to community health research. But it sounds like patient-centeredness grew out of community-based CBPR. But we will definitely revisit some of the more technical technical differences between the two.
Yes, that's right. And I, as a qualitative researcher, I would like PCOR to embrace CBPR more than I think it does. So it would be. That's right. That's right. So I agree, and I also would very interested to hear from all of you about any community-based participatory research that you've already done, because you will. I'm sure that some of you have already done interviews or observations or focus groups or sort of community teach-ins, those sorts of things, and those are really valuable engagement. Those are very good ways of engaging people, and so that is all part of research engagement science. Yes, yeah, it is. Yeah, yes. We'll have to wean you off that, so yeah, I know. I'm just joking. So that's great. That's great. Okay, so let's talk about. So Fatima is going to give you the big picture in session 2. Of the systems and how they all relate, which is really important, because I think context is absolutely crucial to understanding where you fit in as community health workers. And what's quite exciting at this point is that, as Fatima has identified, we know the skills and we know the competencies that we would like, as the American Public Health Association would like us all to have as community health workers, but those things haven't quite been totally nailed down and defined within Illinois. Now, I always find those are the most exciting times to be involved, because they're not, you're not sort of rigid rules. There's actually ways for you to sort of make the best of your abilities and say, this is what I want to do as a community health worker. There's a freedom there, which I think is great. And I think equally, PCOR will help you do that, because it's about, and the methodologies that we introduce and the sources, I'm hoping will help you fly. Okay, so when I come back so that's the next step. So Fatima's going to give you the really big picture. And then I will come back and I will help you think about the sources, tools, and methods. This is what we're sort of beginning which you can draw on. And I will try and help you see. So in the way that Dr. Prokarakan drew on the Chicago data, I will show you how you can access that type of data, so that if somebody comes to you and says, we really need to do something about high blood pressure in the community, you will be able to know where to go to find out the information about high blood pressure in Chicago, Cook County, Illinois. And so what we will be doing at that point is we'll be focusing on the mainstream end of the sources. Okay, so the community-based participatory research is at this end of things. Often it's about collecting histories, it's about collecting stories. I'm going to use that pointer again. That histories, stories, the lived experience. This is the big data end of it, government data, academic reports. And that's why I asked you about whether or not you were familiar with reading articles, because that's sort of more mainstream. So that's sort of, publications in, Journal of Palliative Care and Medicine, Journal of Palliative Medicine, or JAMA, the Journal of American Medical Association. So also, actually, newspapers is interesting as well, because major newspapers are often a great source, or they summarize the data for us. So I'll bring that in as well, so that you can see some, particularly at the moment with COVID-19, it's a very interesting time for the way in which newspapers are actually taking a lead in communicating science and information about science. So we'll do that, but don't worry, we're not going to ignore this group. And so we will also make sure that we come back to that. But the other thing I would like you to think about as well is where you as a community health researcher fit along this line. Do you consider yourself to be more at the mainstream end, or more at the grassroots? And that probably depends on your working environment as much as anything else. But that will affect the information that you want to source. And it will also affect the way in which the tools and the methods available to you to process and collect it. So, for example, one lesson I learned early on when I was here in the States was I did the age-friendly assessment of the city of Chicago. And I wanted to do things like photo voice projects, focus groups. And I went to talk to the collection of department heads at the city, and they said, no, we want data, we want surveys. Absolutely. They just didn't. They said the problem with qualitative research is it's all about opinions, and it's about individuals' opinions. Now, I don't agree with that, and we will get into that later down the line. But I had to choose a tool which fitted the audience. They were only going to listen if I presented data from a survey, and that's really important. And so that's why you need to think about where you are on this line. It's, you know, and then you can match the sources, tools, and methods to your audience. But we will do that, and I look forward to exploring that with you as we go forward. So for me, the core research elements that I would like to introduce to you when we're looking at big data is the sources, and show, you know, so that you can decide yes or no, basically. Is that a good one for me or a bad one for me in terms of my context? Census Data 2020 is an excellent time to do this, because that data is going to come out, and it will actually affect so many things in terms of resources and federal funding and where it goes. Research articles or books about the issue that's coming out of your community. And then the tools are the things like you choose. Is it a survey? Is it an intake form? Is it an interview? Is it photo voice? And then the methods would be something like so a community data walk. So this would be how you would communicate census data results, or how would you communicate big data? I'm just developing a community data walk at the moment, and that for example would be a good method. Okay, so that's where we're all set up, I think. So yeah, I think thank you so much. It's really nice to engage with everybody, and I think, you know, feel free to sort of just mull over any questions, as we said. And I know somebody asked, yeah, there was a question, wasn't there, about methodologies, and I will try and provide yes, so that's very interesting. So I will try and provide a link to that methodologies, PCOR methodologies thing. I'll send that to Fatima so that we can put that on the website. It is possible to get the copy of the presentation slides. I think Fatima will and the team at Worry Free will be able to post those. Is that correct?
Yes, they will be available on the social engine. So I'm posting pretty much everything on in the blogs of the EMBART CHWR team. Mm-hmm. So that is our repository of all the activities that we are doing. And in fact, this particular recording will also be there. However, I think engaging in the slides while it's being presented is the most effective way of learning this material. As I was looking through, we are also thinking about having this program as an online tool later on, but we're going to need every one of your help as to how to deliver this as an online on-demand program, inshallah. But in the meantime, I think pretty much all the materials, all the resources, all the slides, the recordings will be available on the social engine.
Yeah. And I totally thank you very much, Hassan, for your comment that we got problem with social media and misinformation. I mean, I think we are in a moment, I don't know whether you agree with this, but I think we are in a moment where science it's more important than ever to be able to communicate about health science and be able to sort of share trustworthy information with our community members than ever before. And deciding what makes something trustworthy is also something that we'll be exploring. I mean, one of the things that is nice about you becoming ambassadors is that you will find when you meet other ambassadors that PCOR is thought to be a trustworthy site. So it is somewhere where you can go and get factual information that you can trust has been vetted. You may not always agree with it, and you don't have to, but it's considered to be evidence-based and yes, and trustworthy. Yeah. Mm.
And anything, if there is any questions or comments, please feel free to email me or Nabil, and we will see you on Monday at 5 p.m.
Yes, yes. Enjoy the rest of your Saturdays and your weekends. It's really, thank you. I know it's
time.
That's right. All right. Okay. Yeah, I look forward to seeing you all again too. Okay. Bye.
Bye.
Thank you.
Okay, Rouge, you can start the meeting, I think, recording.